This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. It's fall vaccine season. As kids get back to school, the political debate around who should get shots for COVID and other illnesses is once again bubbling up. Changing federal recommendations have left doctors and patients confused about what shots are available and if insurance will pay. And last week, President Donald Trump used a platform of the presidency to promote unproven ties between Tylenol, vaccines, and autism. We'll have more on that later this hour. As federal health guidance shifts, some states are going in their own direction. Connecticut recently announced a new regional partnership with other Northeast states and New York City to combine public health expertise and resources. Joining us now is Dr. Manisha Jutani. She served as a professor of medicine at Yale and is the commissioner of the Connecticut Department of Public Health. Thank you so much, Commissioner, for being with us today.
Thanks for having me.
And for our listeners, let us know if you have any questions or concerns, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. So just mentioned the Northeast Health Collaborative. So, Commissioner, can you tell us about it and why is it needed today?
What we noticed when 2025 really kicked off and we started to see a change in the approach to public health with executive orders that started, with changes to grant terms that we had, with changes to funding, with grants that were cut, we realized that we were in a new environment where we were going to have to adapt quickly and try to figure out how we were going to address these changes. So as commissioners of health departments, we talk on a regular basis through professional societies that we have, usually on a weekly basis, on a national level, but even on a regional level.
Mm-hmm.
And because many of the Northeast states have similar modalities of public health, and we are small states where people cross borders on a regular basis for work, for school, for activities, it made a lot of sense to be able to work with each other and figure out how we were navigating these differences. So we started talking at the beginning of the year and really enhanced those efforts. And when we realized that all these changes were happening, we felt the need to work more collaboratively, not just as health commissioners, but as state epidemiologists who really look at the data that we bring in on a daily basis, looking at our immunizations programs, looking at a lot of our infrastructure that we have. And so we realized that the collaborative could be helpful because we needed to bring in people more than just state health commissioners. We needed the people who actually help us make the work happen on the ground. And so that's really what started off the Public Health Collaborative that has been going on since January. We did announce the collaborative to be able to have people understand the work that was happening as changes were happening. Mm-hmm. And that's part of the reason for the announcement that we made.
Well, then when you say we, so who are the states that are involved? And it sounds like you're sharing a lot of information and resources that you were already sharing previously, but sounds like more today.
So the number of states involved has changed, it's broadened, and I think there are many that have been involved, but when you make an announcement, there is something involved in that that's a little bit different than just working together. Mm-hmm. And so what I would say is that the announcement certainly highlights states that have been involved since the beginning, states like New York, Massachusetts, Connecticut, and Pennsylvania, and the like, and several others, including New York City, so that we have states that have their own health departments, and then we have big cities that have their own health departments. So it is really a combination of both, especially in the Northeast where we have several big cities. But I can also tell you that there are states that might not have been announced per se in that initial press release that have been involved and continue to be involved. And there are various groups that are going to opt in and opt out because unfortunately public health has become quite political and quite partisan, and even though it really shouldn't be either. And so different states have to make choices that work for them. At the end of the day, we are not trying to create any sort of regional infrastructure that supersedes either state governance nor federal governance. And quite frankly, we don't want that. We beholden to our state statutes and federal statutes. And we're not trying to create something else that actually takes the place of either of those things. What we're trying to do is do good public health work and utilize resources we have to do that.
Well, I'm glad you brought that up because I believe it was last week during a media event you told one of our reporters, Sujata Srinivasan, last week that we are not, let me capitalize, not establishing any body outside of the state or federal government. There has been no move to create a regional CDC, none. So this is something you said. Why do you feel like you need to clarify that?
That was specifically in response to a press event that was held last week where there were many people protesting a regional CDC. And there were many signs in the room that said no regional CDC. And I wanted to make sure that the crowd that was there understood that we in no way are trying to do that. And what we are trying to do is leverage resources for people among the states that we help support to be able to make sure that we ensure access and choice to those who want things in our state. And so in that room, there was a vocal group who did not want vaccines. There was a vocal group who did not want mandates. And we are in no way mandating anything. What we are trying to say is, if you want a COVID shot, we want it available so that you can have it. And it's been that way for the last 5 years, and we just want to be able to help ensure that it can stay that way. And so that's the type of access, information, and choice that we are trying to ensure for people. And right now we're in a situation where it is a little bit unclear, and we do know that people have hit barriers, and we're trying to remove those barriers.
And that leads to my next question really is there is a lot of confusion right now about vaccinations and what families across the state have access to. And so what do Connecticut residents need to know about vaccines this fall?
So the main thing to realize is that there's really a three-pronged approach to vaccination. The first is what is recommended by the health department, by your doctor. What do we think there's scientific information to say that this is a vaccine that we believe is in your best interest to take? The second is who can administer it. So we have pharmacists that are regulated by the Department of Consumer Protection, so not by the Department of Public Health. And we have pediatricians as an example. And we work with pediatricians specifically to distribute vaccines, but pharmacies operate separately. And so that's why we've been working with the Department of Consumer Protection and Commissioner Caffarelli to be able to help ease those barriers that people might have. And then the third is insurance. What is going to be covered? Now, there are certain state regulated plans, which are regulated by Commissioner Mays and the Connecticut Insurance Department, third state agency. Again, this is why it is a three-pronged approach. And fourth, which includes our Department of Social Services and Medicaid, because that's another big payer of vaccines in the state. And so you have all these different departments within state government, which the Department of Public Health does not have oversight over all, and that's why under Governor Lamont's leadership and through that collaborative effort, we've tried to clarify for people who should get the shot, where can they get it, and will it be paid for? And what I can say is that from the payment perspective, those that are regulated by the state all have to pay for the shots that are recommended, and that's been pretty clear. One thing that we've seen from the national organization that oversees a lot of privately insured programs. So, for example, if you have insurance from a large employer, that's considered a self-insured plan. And those plans are governed by ERISA, which is federal law. We do not have oversight on that in the state. And the large employers have largely said that they are going to pay for it. So that is at least reassuring. Now, I think that there are other things we can continue to talk about in terms of where these hiccups may be occurring right now in terms of access. But what we really tried to do a few weeks ago is confirm that vaccines are safe and effective, that we in the state of Connecticut want to provide that kind of access and support people to be able to get vaccinations should they want them.
Well, especially since conversations, of course, are still ongoing. And as you mentioned, trying to reassure families that this is the safe it's a safe thing to do or you recommend them to do so. Are you hearing that reassurance from families who are concerned, especially now that we're back in the school season? And of course, I think most of us know this is the time where everyone has a cold or something because we're all gathered.
Yes, absolutely. So, what I can say is anecdotally, and certainly through some of our data that is starting to come in, COVID sort of seems to have taken off first.
Mhm.
And I do know a lot of schools that have seen a lot of COVID cases in this first month of September. Now, often because we do not have all COVID tests reported to the state anymore,
Right.
there's a lag in hospitalizations and deaths. And so I anticipate that, again, as more vulnerable populations get COVID going into the rest of this fall and winter, we will start seeing those numbers, which are consistently reported to us, ticking up even more because I see a lot of healthier people getting COVID right now. Now, October is our big month when we really want people to get vaccinated against flu and COVID. And flu, the ACIP, which is the Advisory Committee on Immunization Practices through the CDC, and what we have said consistently is that anybody 6 months and older should get a flu shot. It is safe, it's effective, it's been done for decades, and it certainly reduces the morbidity of flu in our communities. With COVID, although we recommend it for everybody 6 months and older as well, there are two populations that really can benefit the most. Those 65 and older and 6 months to 23-month-old children. So our youngest and our oldest. And, particularly in that pediatric population, there are new babies being born every day. Pregnant women benefit from getting a COVID shot. For your average child and adult who may not have comorbidities, that would definitely say that they should get a COVID shot. It is still recommended, in my opinion, because it reduces the severity of disease that you may have yourself. It helps protect those youngest infants who can't even get vaccinated. It helps protect pregnant people around you, older people around you. So it's still our recommendation. And I do think that some of that message is getting through. I think there, though, is still a lot of noise and there's a lot of confusing messaging. So that's where some of the confusion happens. Again, I mentioned the ACIP. The ACIP also voted similarly to what we're saying, which is 6 months and older, everybody is eligible to get a COVID shot. However, what they wanted to make sure is that there is shared decision making, that people are aware of the risks. And that's true, quite frankly, for any shot that you take. We really want people to be aware of whatever risks there may be and make sure that they're fully aware and that it is a shared decision. And so that's something you can always have with your doctor or somebody that it's administering the shot to you.
Well, and amid the noise too, even so, Connecticut has one of the highest vaccination rates in the nation. But last week, as you mentioned at the media event, that there were protesters that are voicing their concerns over vaccines. Are you concerned about the growing hesitancy of vaccines in the U.S. and here in Connecticut? Are you seeing it locally?
So I think we certainly are hearing from a certain group that is hesitant. And I think that is not a uniform group. There are people that may be hesitant about one shot, about two shots, that generally are okay with most of their shots. And so there's really a spectrum of this. And I do think that some of what we're also seeing is that because there is a lot of noise and confusion around this, there are people who may not have been hesitant who are now saying, well, maybe I should think twice about that. And is this the right thing for me? What I can also say is that there are many diseases that because we've done so well with the reduction of certain diseases with vaccination, there are things that people don't even see anymore. And so there are things in my lifetime that we can talk about. Let's take chickenpox, for example. I had a bad case of chickenpox when I was 12 years old because I didn't get it till then. There are many, many children who have never had chickenpox.
Right.
And we don't really see it that often anymore. I can tell you, as an infectious disease doctor, shingles later in life is a horrible disease. I'm not just talking about a rash on your body, whether it could be meningitis or something else. We have meningitis in infants that because of the Haemophilus influenza vaccine, which is a bacteria, used to fill our pediatric wards with children who used to have meningitis, where that is not the case anymore. In real time, we're seeing this with RSV. Every winter season, we would see pediatric wards filled with kids with RSV, door after door after door. And with the monoclonal antibody or vaccination for pregnant women that we're seeing, we're already seeing a change in that tide. When that happens, you see a great reduction in infectious disease burden, potentially a bigger influence of chronic disease burden. And I think people start to forget what the burden of infectious diseases actually does in our society.
When you mentioned some of these vaccines that are typically taken when we were kids. So there's also been confusion over this as well because federal guidance has changed on the measles, mumps, and rubella and varicella, which is chickenpox, as you just mentioned. So those guidance have changed on these vaccinations. So can you talk about what's going on there?
It is a little bit of a complex story and nuanced. And so I'm going to have to go through a little bit of detail to really help people understand it. So at 12 to 15 months of age, we recommend the MMR vaccine, which is measles, mumps, rubella, as you mentioned, and the varicella vaccine. At 4 to 6 years of age, we recommend both of those vaccines as well. It used to be that kids would get 2 shots for both. In the early 2000s, a co-formulation was developed just to have a 12 to 15-month-old potentially have 1 less shot and a 4 to 6-year-old have 1 less shot. So the MMRV as 1 shot was developed. When that was brought to market, what was identified was that there was a slightly increased risk of febrile seizures, meaning that young children, when they get high fevers, they can sometimes have a seizure. And when you took the combined shot, MMRV, it was higher in the 12 to 15 month of age, but it wasn't in the 4 to 6 year old range. So what most pediatricians would say is at 12 to 15 months, they recommended getting the 2 shots because even though it was an extra shot, at least you reduced that potential risk. But at the 4 to 6 year old range, they recommended the 1 shot to have 1 less shot for the child. It used to be that the shot was approved for both age groups. And in the state of Connecticut, in the 12 to 15 month age, 17% of parents chose to get the combined shot, the 1 shot. They accepted that risk potential of increased risk of febrile seizure. Only 17% of parents chose that. The vast majority of those people were in private practices, about 5,000 people every year. And what the ACIP voted on a week ago, almost 2 weeks ago now, was that they no longer recommend it for that 12 to 15 month age group. So that vote, when you say recommend, that ties usually to lack of insurance coverage, but it depends on the provider. For the state and federally funded programs, that ACIP language of recommend ties to coverage. So what that now did is it said that parents who chose to get the single shot in that 12 to 15 month age no longer have that choice. Some of them may be able to have the choice, may need to pay for it though. And so they would need to check with their insurance provider and with their pediatrician. And so to me, that was disappointing because this was a choice parents had. And now those 5,000 families every year, for whatever reason, you may have a child that has some comorbid condition or has a serious fear of syringes and vaccines. And maybe a parent says, that 17% of parents says, you know what, I'm willing to take the chance on a febrile seizure to have 1 less shot for my child. Now those families will have less choice.
Well, I want to take a moment to remind our listeners that you can give us a call and share your stories or concerns with us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. I'm going to take a moment to grab a call from John, who is calling to us from Richfield. John, you're on the air.
Hi, thank you so much for having this discussion.
Of course, go for it.
My wife and I have been having a really hard time actually getting access to the COVID vaccine, to the pediatric COVID vaccine over the past couple of weeks. We tried at our local pharmacy and they said they wouldn't administer it, whether they had it or not. And then we actually made an appointment at a chain pharmacy a little further away. And when we got there, even though they allowed us to make the appointment, they said they didn't have the supply. So we're getting a little bit into panic mode of like, is there even pediatric doses available, or what is this going to look like over the next couple weeks?
Well, thanks, John, for sharing your experience. And anecdotally, we've also on the team here heard from other families who went to their pediatric doctors and they did not have the vaccine at the time. So, Commissioner, is this something that you're hearing?
This is absolutely something I'm hearing, and this has been top of mind for me for the last week. And I need to explain a little bit of how our vaccine supply works in the state of Connecticut. So, John, thank you for raising that question. I think there are two parts to this. The first is about going to a pharmacy. Now, many of the pharmacies do have pediatric vaccines, but different pharmacies are having challenges as it relates to what they feel they can or cannot do. So the first is that there was the PrEP Act that was passed federally during COVID that basically said that children 3 years and older could go to a pharmacy and get vaccinated for COVID or flu. Now, we also have state law that says if you're 12 and older, you can get a pediatric vaccine, any kind of pediatric vaccine, in a pharmacy. However, there is nuance around COVID and COVID vaccines in particular. So because of this confusion, pharmacies are choosing to interpret what they can or cannot do differently, and different pharmacists are working on that. So this is something that we are working with our Department of Consumer Protection to really talk about with the pharmacies in terms of what can or cannot be done in pharmacies. Because again, as I said, I do not have oversight on pharmacies, but this is an all-of-state approach. We are in constant communication with DCP, and I have raised this concern over the last week and will do so again. I appreciate the real-world example that you shared, John. But I do want to also take a moment to explain something that is in my control and that we are seriously concerned about. So I explained the ACIP vote that happened now 10 days ago. Now, normally in the state of Connecticut, we have a universal vaccine purchasing program. What that means is in 1994, a federal law was passed which said that all vaccines for Medicaid children, uninsured children, would be covered by the Vaccines for Children program, which is a federally funded vaccine program. And we purchased those vaccines through the CDC. In 2012, the state of Connecticut passed a law so that all children in the state of Connecticut could have their vaccines purchased by the Department of Public Health, the way that we do for VFC. And this became our Connecticut vaccine program. And our insurance providers in the state are assessed essentially a tax that allows them, it's an assessment. That assessment on the insurance program and the insurance providers in the state, funding through that, again, comes to DPH so that through the Vaccines for Children program and that insurance assessment, together, we have funds to purchase all vaccines for children that get their vaccines through pediatricians in the state of Connecticut. That ACIP vote that I mentioned that happened on a Friday, normally the CDC director signs off on the vote immediately. That is what then dictates us being able to start ordering vaccines. And that did not happen on that Friday. And then all of last week, those ACIP votes were not signed off. And so we as a state have not been able to purchase those vaccines to date off of that CDC contract. So we are working fast and furiously to work with federal colleagues and partners and think of creative ways that we could solve this problem. But John, I do know that this is a problem certainly in pediatricians' offices, but I will take your concern back also to our pharmacists and our Department of Consumer Protection.
And thanks for your question, John. We're currently speaking with Dr. Manisha Dutani. She's the head of the State Department of Public Health. Coming up, she'll stay with us and talk about the scientific and medical groups that are pushing back on comments from the Trump administration on autism and Tylenol. You can also join the conversation, 888-720-9677, or find us on Facebook and Twitter at Where We Live.